Hi everyone, my name is Sonam and I'm a resident doctor specializing in sports and exercise medicine. Today, I wanted to answer a question that I receive quite a lot. And it's pretty much, what does a sports medicine physician actually do? First off, a sports medicine doctor is an advocate for exercise in medicine and advocates for both athletes and the general population. And you'll quickly find out that most sports medicine physicians are athletes themselves. Personally, I enjoy rock climbing and I played ice hockey. I have had colleagues who've played varsity college level football and basketball and others who are Olympic athletes. So the range is extremely variable and wide. So let's get back to what do we do as sports medicine doctors. I'm going to break up our duties in multiple categories. The first is that we're involved in sports medicine coverage. So this is the stuff that you see me making videos on. We're on the sidelines, we're caring for athletes. If there's an injury on the field, we're the ones with the athletic therapists, with the trainers, at the bedside or at the courtside of patients, really trying to assess them and make sure that they're safe. This involves anything from fracture assessments to concussion assessments to any sort of wear and tear injury that takes an athlete off the court or field. The other thing that's involved in sports medicine-based coverage is that we can sit on committees that basically put together action plans for a medical emergency or how an event can be run at a larger scale and be still medically safe. So they'll have medical directors on these committee meetings, and a lot of sports medicine physicians will take that on as an additional form of responsibility when it comes to event coverage. So the second area that we focus a lot on is musculoskeletal care. So this is kind of our bread and butter. Anything MSK. What does that mean? Essentially it means muscles, tendon, joints, skin. And that's what we deal with. So anything from arthritis to a tendonitis to heel pain, foot pain, neck pain, back pain, we're pretty much the go-to experts in that area. Now the third domain that we're involved with, and one that you may see a lot more of on this channel, is athlete care. So as sports medicine doctors, we can take on a role of being the team physician. What does that mean? So we care for the team as a whole. So we are not only their sports medicine doctor, but we're also their primary care physician, which is why you have to have a good breadth of knowledge. You'll actually see quite a lot of medicine that isn't just MSK, that isn't just injuries, that you still need to be aware of. If they have a sore throat, you have to deal with that. If they got sick somewhere else, you have to deal with that. In the era of COVID, that's something else we have to look into. So it's a really wide basis, but it's a pretty interesting aspect of our jobs. And one you'll see a lot of, especially when you look at the NBA, NFL, NHL, most teams have a team doctor on site. One of our fourth domains is really promoting exercise as medicine. And what does that mean? So we know research has shown that exercise decreases inflammatory markers, increases cognitive capacity, decreases maybe biological and chronological aging to some sort. And we really work hard to promote this. There are certain patients, for example, that require some extra guidance and modifications to their exercise prescription based on their medical conditions. So we will see people who, for example, are suffering from obesity, who are suffering from spinal cord injuries, who are suffering from cancer, neuromuscular disorders, and we work with them to create an exercise plan while also treating their other medical conditions. So the last area of sports medicine that I think is one of the most interesting areas is the procedural aspect. A lot of what we do in terms of a physical examination point is very hands-on, but we also do hands-on procedures that are ultrasound guided. So I myself am being trained in ultrasounded guided therapies. What does that mean? Using the ultrasound to guide hip joint injections into other joints, for example, being able to aspirate or take out swelling in different areas of the body. And it's quite an interesting area of medicine, and one that's growing quite a lot. At the same time, you get really good at being able to maybe take these portable ultrasound machines onto the field, and when an athlete gets hurt, you can provide a quick assessment to see, does this tendon look torn? Does this look worrisome? And it kind of gives you a little bit more of an extension of your physical exam. As you can see, our breadth is extremely large, and I hope that this video sheds some light onto our true scope of practice. If you have any questions or comments, put them down below. As always, if you'd like to see more videos like this in the future, or videos where I go over injuries that common athletes face so that you can better understand the anatomy and the biomechanics at play, please subscribe to my channel. For now, that's all.